Welcome to the Two Girls and a Cup of Wellness podcast. I'm Marie. I'm a nurse practitioner committed to whole health care and helping my patients live vibrantly.
And I'm Chrissy, a yogi, breast cancer thriver, author of For the Love of Jugs, and guide for the mind, body, heart, soul healing. Together, we will empower you with integrative tools and real conversations. So grab your cup and dive into wellness with us.
Jodi Hart is a certified clinical thermographer and the owner of Treasure Coast Thermography in Stuart, Florida. She specializes in preventative thermal imaging that helps identify patterns of inflammation and physiological changes in the body before symptoms often appear. Trained in 2019 under thermographer pioneer Barbara Thurman, Jody spent several years working in clinical thermography before launching her own practice in 2023. Today, Treasure Coast Thermography serves clients from across the Treasure Coast and South Florida who are seeking proactive, non invasive insight into their health.
Using one of the most advanced high-resolution medical infrared imaging systems available, Jody provides breast thermography as well as comprehensive full-body thermal image studies. Her work often complements functional and integrative medicine by helping clients and practitioners better understand patterns of inflammation, circulation changes, and nervous system stress throughout the body. Jody is known for taking the time to thoroughly review each client's health history and imaging results so they leave with a clearer understanding of their body and potential next steps. Her goal is to empower people with information that supports a more proactive approach to long-term health and wellness. Hello, everyone, and welcome back for another Two Girls and a Cup of Wellness podcast. This is Chrissy.
And I'm Marie.
And today, as you already heard, we have the amazing Jody, our wonderful thermographer friend, joining us. Welcome, Jody.
Hi, thanks. Thanks for having me.
We're so excited to have you, and we both absolutely love and adore you. And so, when thinking about who to bring on as guests, both of us were like, "Oh, we got to have Jody.
I have Jody.
We got to talk all things thermography and
Mhm.
inflammation and give the people a little bit more information about this amazing tool that you provide." So, let's just kind of start with first off, I get a question a lot. Well, Chrissy, what is thermography? Why don't you explain what it is, just to give the listeners more understanding what the actual scanning is and what it's good for, and then we can kind of go from there.
Okay, yeah, that's a great starting point. A lot of people never heard of thermography, so a lot of people come to me. When they think of thermography, they think of breast thermography and breast imaging, and that is a very big part of what I do. Is a lot of women come to me for breast, but we actually can look at many areas of the body and detect inflammation and heat patterns going on throughout the body. And since the body is all connected, we're not looking for structural imaging. We're looking for those physiological changes, the metabolic changes going on in the body, in the breast, in the thyroid, gut health. It's all connected. So we like to look at the body as a whole, detect those heat patterns, and try to implement changes to kind of change those patterns around and be proactive and try to um, treat I shouldn't say treat, but notice things that are probably occurring in the body before symptoms even appear.
Yeah.
Okay, so I was talking to Chrissy before, so you can actually see the inflammation process happen before maybe something shows up on a PET scan, like a lump, right? Maybe,
Yes.
maybe
Well,
not.
and when you're doing like a mammogram, ultrasound, those studies are looking for structure.
Hmm.
Thermography, we're not looking for structure. We're looking for those physiological changes. So if something is detected, for instance, in a breast thermography, if we're detecting something going on, we're not actually detecting the structure itself. We're
Hmm.
detecting the physiological changes, kind of the blood flow,
The
the
blood flow.
inflammation. And that when you have inflammation occurring in the body, there's going to be the metabolic change, the blood flow kind of feeding that area. So that's
Hmm.
what we're actually detecting.
Okay. Do you see, is it mostly women that come to see you for breast?
Yes, mostly women, but it's great for men as well.
Hmm.
We can detect any heat in the body. There's certain things it's better for than others. But for breast, amazing. Thyroid, carotids, sinuses and teeth. The big connection between the sinuses and teeth is very important with breast health. Lymph congestion, hormone imbalance, um, autoimmune patterns will show up. So there's different patterns they're looking for that will direct you on. Then you can take a proactive approach and try to turn it around, turn those patterns around and calm that inflammation before something develops.
Right. So this is definitely thermography is way more of a proactive approach. We want
Absolutely.
to find things before it turns into something like a tumor or a blockage or anything like that. So it's not technically a diagnostic tool
Screening,
like
right?
right,
Right.
exactly, like a
Mhm.
mammogram or CT scan or PET scan, they are
Ultrasound.
certainly looking for masses and tumors, but this
Right.
is studying the body and keeping track of the body before something major
Mhm.
happens, and that's probably why a lot of doctors may not necessarily, uh, suggest doing it to their clients, and
Well, it gets back into that, the physicians are looking for something. So when you order a mammogram, you're going to make sure that there's no lump there already. And
mhm,
instead of saying, well, let's order a thermography and see if inflammation is starting before the lump is formed. But again, it goes back even further that it's our system isn't proactive. We're reactive.
reactive
It
for
Mhm.
sure, for sure.
Absolutely. And thermography is FDA approved. It's approved in conjunction with other studies. So for me personally, I like to pair it with an ultrasound. So
Mhm.
you're getting that structural set of imaging and the physiological changes. Especially in women's health, in 2023, they passed a new law that on your mammogram report, they have to put on the bottom of it about dense breast tissue.
Mhm,
And
Mhm.
so a lot of women are waking up. It'll say right on there, if you have dense breast tissue, you may need additional studies because
Mhm.
that density is showing up as structure, kind of blocking out the structure that could be developing. So
yeah.
then they'll send you for an ultrasound, they'll send you for further studies. Um, but it doesn't matter in thermography if you have dense breast tissue. And over 60% of women do have some form of dense breast tissue.
Mhm.
Mhm.
So for us, it doesn't matter because we're not looking for the structure. So we can see, past that, the dense breast tissue and just see the physiological changes of um, going on in there. So it's
Can you
great
talk
for
about the
women.
equipment a little
That's
bit?
exactly where I was
Yeah, I was
gonna go
thinking the
too.
equipment
Let's
because
talk about, yeah, like the
ultrasound is using sound waves and how talk about the equipment.
Yeah, so I use a FLIR infrared heat camera. It's detecting the heat, those physiological changes. I have like top of the line camera, and a lot of people actually don't think about that the camera quality really matters. Just like any technology, it gets antiquated. And so by taking clear, really precise images, when I upload those then to the doctors that are reading those images and creating the report, they have a way more precise idea of what's going on there. And you can really hone in on those heat patterns versus someone with like a 20-year-old camera that's very antiquated and not as detailed. I think
Mhm.
some cameras that are old will have like 40,000 megapixels, and mine has close to 400,000. So
So
there
that's
is a
something
difference in the camera quality for sure.
yeah, and that's something that our listeners, if you are interested in getting a thermography, scan done, maybe that's something that you when you are looking around in your area, wherever you live, asking around for different thermographers, maybe that is something that you consider in your questioning and in your decision making.
Yes, absolutely. I think a
So
lot of
tell
people
us a little
forget.
bit about the actual it went well, I mean, both of us have actually had it done, but a lot of listeners may not have. So walk us through a typical appointment.
So you're gonna call me. I set up the appointment. You're gonna come in. There's preparations you're gonna go through. It's a heat sensitive camera, so I'm gonna have you not having caffeine 2 hours before you come in. Not doing hot yoga or
That was tough for
sauna
me.
or yeah, anything like that. Very active that the morning of. No chiropractic or acupuncture or anything that's gonna change your heat patterns. No seat heaters as you're coming in if are having an upper body. So there's those things to prepare for. No deodorant, no lotion. not restrictive clothing. And then when you get there, I'm going to have you cooling while I'm entering all the information for the doctors. You just stand in front of the camera. There's no compression, no no radiation, no anything. You're standing in certain poses in front of the camera. I take the images, and I upload all those images. I usually go over the images with everybody that comes in. I like to show them and educate them on what the images look like, what the doctors will be looking for. I upload those to the board certified physicians trained in reading these, and they create a report. They send that report back to me, and then I send it to you, and you get to come in and go over it in our office with Dr. Leo. If you want, if it's just breast, you typically people don't usually do that. If I do like an upper body or a full body, um, they usually will take advantage of that free consult and change, get ideas of how they can change things around.
And roughly how long does that take once you have the appointment to potentially getting the results back and meeting with a
It's usually within a week.
Okay.
It can take 2 weeks to get the report back, but it's usually back within a week.
I do want to say too that for the listeners, you aren't wearing any clothing. You're allowed to keep your underwear on, correct?
Yes, absolutely. Yep.
But you do a great job of keeping the lights dim. I feel very comfortable. I wasn't
Yeah.
concerned at
Yeah,
all.
and I have like a my camera is uh set up where I can be in the other room, my little cubby around the corner, and so everybody doesn't have to be exposed, but usually us women don't really care. And sometimes I have to pop my head out there to show them where to stand or turn or something to
Mhm.
get you in the imaging properly. But other than that, no, it can be pretty private.
Yeah.
And
Yeah.
also, I don't know if you remember this, Jody, but I flossed on my way there. I'm a car flosser
Oh my god.
with my organic bamboo picks.
Hello, my name
And
is
you
Marie, and I'm a car flosser.
I had a friend that said, "I'll never buy a used car because people floss on them." I was like, "Oop, that's me."
That's
Totally.
amazing.
And I drive my cars until they die. But you were like, "What's up with your mouth? It's so inflamed." I said, "I flossed the whole way here." So it was interesting that you could see that right away, that heat, and my
And
teeth
it
aren't
will,
falling
it'll
out.
definitely
They're
those
still there.
things will definitely change your heat patterns. I had a lady the other day come in for a scan, and I was like, "Wow, her whole chest up here was, like, all really hot." And then after I uploaded the images already when we were going over it, she said, "Oh my goodness, you know what I wore," as she was driving in, like a belt type thing around her chest that was like an energy for healing, and
Hmm.
she said it does cause, some heat. And I was like, "Oh, yeah, definitely." So, yeah, any little thing kinda that will change our heat patterns will definitely show up, so
How about medications, prescription meds, or even vitamins?
not typically.
Okay.
There's a couple things like beta blockers, some things that we probably shouldn't be taking beforehand, but typically not.
Mhm.
That's usually fine.
Interesting.
Yeah. So, what got you into this? How did this all come about that you were like, "Wow, thermography is so cool and I wanna become one?"
Yeah, I mean, I heard nothing about it, back in the day. I think I was about 38, 39. I was still breastfeeding my son, and I felt a lump in my left breast, like it was kind of like a structure. And I couldn't have a mammogram at that time, and my husband actually ended up finding thermography for me. So I went to Barbara Thurman, and she did a thermography scan on me, and nothing really showed up in that area, but she sent me for an ultrasound as well, and they confirmed that it was dense breast tissue, kind of superficial to the surface. And I just stuck with that, and I kept going for thermography scans every year. Barbara was an acupuncturist and had been doing thermography for like 18 years at that point. She was kind of the pioneer of thermography in this area. Nobody was doing it at that time, and she was amazing. So I started doing it way back then, and when she decided to sell her practice and moved out of the area, I invited her to come into our office and do her scans out of there when she would fly back every few months. And so she just came into our office, and when she decided to sell the business, she trained me. And I had actually one of my best friends was battling stage. I don't know if it was, well, she had triple negative. I don't know what state she was, but she was only 39. And she said,
And
Jody,
triple negative is a breast cancer too, for those of you who don't know.
yeah,
No.
yep.
Mhm.
And she was very young. And she said, Jody, when she was going to sell the business, she said, we should do this together because I'm going to need breast cancer, or I'm going to need breast thermography for the rest of my life. And I said, wow, we should buy this, business. And so that's kind of how I started. And I just loved it. And 10 years ago, I wasn't feeling that great. And Barbara suggested I did an upper body scan at that time. So I was like, because I was just doing breast every year. And then when I did the upper body scan, I was like, wow, that really gives you a lot of information because you're getting, the abdomen, so you're getting digestive health ideas, liver congestion, thyroid, carotid, sinuses, teeth. You're getting a lot of information. And I just, started with that. And that's how I ended up starting this. And then, so I did it. Barbara trained me, I guess back in 2019. And I started Treasure Coast Thermography in 2023. And I've just been, doing it ever since. I love it. I think it's a great holistic approach with, minimal, there's really no downside to it. There's
Yeah,
no
it's
radiation,
not
no
an invasive
compression, no
either.
nothing. So
Yeah. It's very kind to our bodies. It's a
Mm.
non-invasive type of tracking, to see what's going on from a heat perspective, right? And like you said
yes.
before, where heat starts to congregate, then cancerous cells could also be congregating.
Mhm.
Or also, I've seen, and we'll show some of these thermography scans, like actual scans. We'll put some of those up on our links here in the show notes, but also on
On
some of our
Instagram
social media
too. Yeah.
posts, just so that for those of you who really don't know what it looks like, she's got some really amazing pictures of scans. And one thing that I thought was really, really cool is when you talk about the heart, right? So when you're looking at kind of like the heart space and where the heart is, if it's blue, that is no good. Please explain that.
Yeah, because if you're blue, black is the coolest, going down to blue, all the way down, green, yellow, red, white's the hottest. So certain areas always show up hot, certain areas always show up cool, but you don't always want cool. For instance, in the heart area, if you're having a blue, nice, cool area in the heart area, it may mean that you're not getting blood flow to
Blood
that
flow.
area.
Yep.
Yeah.
If
Yep.
someone has low blood pressure, your whole face will show up really, really blue, cool, because you're not getting a lot of blood flow. So there's certain patterns, yes, that'll show up cool. Um, and hot hands, for instance, if you get hot hands, they call it the white glove effect. That will almost always indicate diabetes. Certain
Mm.
patterns show up like a mottling pattern all over the body will kind of lean towards inflammation, autoimmune patterns. So it gives us a good idea, and then we can just dive deeper into that. It's not going to tell you, hey, you got, two clogged arteries, but you're going to, wow, it might have been something you never even knew. Then you're going to go for further testing.
Mm,
Same with the carotid arteries that lead to stroke in the neck. If those show up hot, doesn't necessarily mean that it's got a lot of plaque in it, but it's an area of concern. You might want to get it checked out, especially if stroke runs in your family or anything like that. It's something you might not have known until you had this study done.
yeah.
Mm.
So what are some of the offerings and the suggestions that are given? Um, let's just talk about breasts first, because that's always where my mind goes, right? So if you're seeing, I mean, I'm sure that it depends on each person and each scan and how much inflammation you're seeing, but what are some of the next steps that people take? Is it like, we'll see you back in 6 months and maybe you should try these supplements or try this lymphatic flow or try this or that? What are some of the suggestions and offerings?
Yeah, absolutely. That's a great question because with your thermography report, they often will put in there, they give you suggestions on how to change your breast health around. I mean, as you know, Chrissy, working with you with the lymphatics, lymphatic congestion shows up, hormonal imbalance will show up in the chest area a lot of times, the armpits, all of the chest with the lymphatics. So they will give you ideas. And then, I can help walk through ideas of how to change that around, dry brushing, your yoga. breath work, vibe plates, all those things to move the lymph. If digestive stuff shows up, then we'll, take a different approach, like maybe GI map
GI
testing,
mapping, yeah.
hormone testing. If your hormones are off and you're having a lot of symptoms, we can run Dutch tests and
Mhm.
hormone panels and go from there. Um, but they will want you back if you do your first scan. They will want you back in 3 to 6 months for your baseline. And the reason they do that is because we all have heat patterns just like we have our own fingerprint. But a big thing in thermography is comparison. So every time you come in, they are pulling up your past images and comparing them to your current images.
Mm.
Therefore, if you start implementing changes like the lymph, working, moving your lymph and implementing those changes, you will see on your next scan, hey, have has what I the things that I started to do, is it taking those patterns down? And they don't want you going a whole year after your first scan, because maybe they don't know, the doctors that are reading these images don't know, is that just her typical heat patterns, or is that something that's just starting? They don't want you going a whole year without having that looked at. So they will tell you to come back in 3 to 6 months after your first one. But just for
Yeah.
breast, if you did a full body or an upper body, you don't have to come in 3 to 6 months later for a whole upper body. Just the breast is the only area that needs a baseline.
Yeah. And that is kind of really nice that you offer different types of scans. So you could do whole body, upper body, breast. And I remember when I first met you, Jody, we were on the phone for quite some time and you were giving me a lot of amazing information about thermography. And that's why I feel like it's so important to have this talk here for more of our listeners to listen to. But um you know, you had mentioned, because obviously breasts for me was the number one thing. I had, I think, been a year out of my mastectomy and my bilateral mastectomy and my protocols and everything. And that was one thing, because I didn't need mammograms any longer, I still want to be able to track what's going on in my breast. So thermography for me is like really great and beautiful. But what was really nice was I wanted to make sure, obviously, that the whole body was good. So I did, I think, a full body or upper
I
body, I
think you
think it
did
was.
upper, yeah. Hmm.
Yeah, and then after that, just sticking with just the breast, and maybe just for some of our listeners, maybe that's where you start out with, for the first one, start off with doing either whole or upper. And then from there, as long as they don't see anything of concern, or anything to watch, maybe concern's not a great word, but anything to just kind of keep track of,
Right.
then maybe from there, you kind of just focus on breast if you're wanting to move forward that.
Absolutely.
Mhm.
Yeah.
Yep,
And
that's
that's
what
why
I
I
always
really love
tell
it.
people. I think an upper body is a great starting point. I mean, full body is great, but if you don't have anything going on in your legs or your feet, like diabetic neuropathy or anything like that, that you're specifically looking for, upper body is sufficient. And maybe you want to just do that every couple of years, the upper body. But I always tell people, at least stick with the breast. That's what I did. I was doing breast, every year. I wasn't feeling good. And that's what made she suggested doing the upper body. And, I was like, wow, it's a lot of information. So I just stuck with doing upper body. Some people choose to do full body every year. It
Mhm.
just depends on what you want to see. A lot of people want to track. They're implementing a lot of changes, trying to detox from mold, or, they change their gut health around. They're trying to move these patterns down in the downward um, trend. And so by doing another upper body scan, you can see, is what I'm doing working? It doesn't happen quickly. In some instances, takes a long time to change your heat patterns around sometimes. So, a year doing it, another upper body might be what you want to do. If not, but I always tell people, keep up with the breast.
Yeah.
Do you
Yep.
see a lot of inflammation in thyroid?
Oh yeah,
Yeah,
absolutely. Yep.
I
And with
figured.
women especially, I mean, you girls know the connection between everything in our
Mhm,
hormones, the thyroid, the gut health. I mean, the neurological component. I mean, it's all connected.
mhm,
So
I love when you start to talk about the correlation of your mouth and your teeth to specifically our breast. And I know that you when you're doing the upper scan, the breast and up, you can see around the jawline too, and the teeth and everything. And I have heard multiple times that there is a correlation between when one has root canals or any type of mouth work
Metal,
kind of done
the metal
with, yeah,
amalgam
yeah,
fillings. Yeah.
with breast cancers. And I actually never had a root canal, but I do have fillings.
Mhm.
And I know, that's not a very good thing. And there's a huge correlation. So can you talk a little bit more about that?
Yeah, absolutely. There is definitely a link between that. It's not to say everybody that has a root canal or, is going to have like a cavitation and that's going to lead to breast health. But um, it does definitely have a correlation. Not so much fillings and stuff, but wherever there's teeth removed, your wisdom teeth, root canals are a big one because they're basically just kind of trapping that bacteria in there. In some instances, it will go into the bone and create like a cavitation. And you will be able to see the mouth shows up really well on thermography. So you will see that heat in there, and often it tracks down. And almost 90 some percent of the time, if a woman has a root canal, let's say it's just one, and she also ends up developing breast cancer, almost 90% of the time in thermography, the root canal and the breast cancer are on the same side.
That's wild.
Mm.
Also,
Wild.
heart disease also, there's a connection between that and heart disease. I guess it's just the fact that it kinda goes systemic over time, that
Mhm.
bacteria. Um, I had a lady come in a couple weeks ago. She came to me about 6 months ago, and she saw a biologic dentist, and she had all of her amalgams removed. She had her root canals removed and cleaned out. He sent her to me, and we did a thermography scan on her, and one area in her mouth still was lighting up really, really hot. She took the images back to the biologic dentist, and did one of the cone beam scans on her, and he said, "Wow, I think I missed something." She had it cleaned up. Oh, and she was having chest pain for like 8 months and couldn't figure out what the chest pain was coming from.
Mm.
She went in for all kinds of, testing. They couldn't figure it out. They just thought, we don't know. So she was just dealing with it. And when she went back and showed him the thermography, he said, "Wow, I missed something." And he went back in and cleaned it out. She came back to me last couple weeks ago, and she said as soon as he cleaned it out, a week later, the chest pain completely went away
Wow.
and the heat on the thermoscan was gone. So it's
Wow.
definitely a
Wild.
big one, in the teeth and sinuses and everything show up really, really well.
That's interesting.
That's
Yeah.
very interesting. Wow.
Yeah.
I'm like just blown away.
Yeah.
We're just like, okay,
All
wow.
right.
Thank
I
you
know.
for that.
You
That's
don't
really,
really connect, that everything's connected in the
We are all
body,
yeah.
but
connected.
it's
Yeah.
it's pretty,
It's what
mind-blowing when
it's
things like that happen. It's like, wow. I mean, that's why I love
Mhm.
doing it. It's like, wow. And I
Mhm.
love to give people ideas of, even if like they come in and they only wanna do breast, just for myself, I will take an extra image and look at the mouth just in case.
Mhm.
They're not gonna report on it because we're not doing a whole, upper body, but I look for myself just to see if there is anything, so I could, like, if I saw something, I'd be like, "Wow, you may wanna look into this," you know?
Yeah.
But it's a
Mhm.
big connection, so I do like to look at the teeth.
It's beautiful. Yeah. That's really kind of you too, to kind of take it a step further rather than just doing what you're told to do, right?
I don't
Taking it a
ever
step
wanna
further.
miss anything, I like to give them as much, information as I can. And a lot
Yeah.
of times, like, I had a lady call me today and said, "My Cologuard test came back positive. I want to come in for a thermography scan." I was like, no, this isn't the test. I'm not going to try and take people's money and promise I can, like look in and see anything, in the colon.
Yeah.
This
Mhm.
isn't a structural image. So I'm not looking into the colon. It's not the test for everything.
Right.
There's certain things that this isn't the test for. And I'm always honest with people. Like, that's, you know, no,
Yeah.
this
That's
wouldn't be
good.
the greatest test for that.
Good. Well, if there were three things that you could suggest to our listeners to help with, to help with inflammation, right? To reduce inflammation and help with the lymphatic flow. What would three things that if any of our listeners don't do anything, right? If they do nothing, like what are three easy things that they can start with today?
Well, obviously, with you, Chrissy, we can start with movement and breath work. Mind is a biggie. Of course,
Yeah.
as you know, Chrissy, with us just doing the Annie Appleseed project, I mean, our mind and our thoughts are huge in our health just overall.
Yeah.
But, toxins, like, the littlest things from using clean deodorant,
Mhm.
clean products, not the
Toothpaste.
chemical toxic makeups and lotions and just to try to use clean ingredients, a deodorant without aluminum if you have to even use deodorant, underwires in our
Yeah.
bras are
Mhm.
huge. Try to stay away from those. That traps the lymph. I see a lot of congestion, and in thermography, we actually image in that area in the bra line because a lot of stuff does start there because of the lymph getting trapped there.
Yeah, that
Um,
constriction. Mhm.
Yeah, and
yes,
I don't since I had the appointment with you, I don't buy underwear bras anymore.
I know it's a
I
big
don't
one.
wear
I
them.
used to wear them too, but once you
Yep.
get out of the habit
Yeah,
of
you're fine.
wearing them, you could never wear another one again.
Mhm.
Being braless is actually the best, but I get it. Like we can't all go
Yeah,
around without a bra.
The
So,
husbands might like it, but
that's true. That's true.
well, that depends,
Yeah.
Not after 3 kids and, being 50 some years old might not be the best idea. But, what else? The
Oh, I have a
toxins
quick
is huge.
question
Uh-huh.
too.
Mhm.
With breast implants,
Yeah.
obviously, there's a lot of women, myself included, because I had a mastectomy, I have breast implants. How good is it detecting still inflammation with implants?
It's perfectly fine. It does not matter for thermography if you have implants, because remember, we're not looking for structure.
Right.
We're
Mhm.
looking for those physiological changes. So the structure of that is not blocking anything.
That's good to know because a
Yeah.
lot of times they can't get that picture with a mammogram.
Yeah.
Yeah.
And I have a lot of women come to me with they're having issues after their implants. Tons of
Mhm.
women are coming to me because they're having, inflammation
Mhm.
in their entire body after having an implant or the implants put in. And they'll go through explant surgery and all that. I mean,
Yeah.
and we'll look at their inflammation markers in their body because of that.
So
That would
do
be
so
interesting
after
before and after, right?
yeah, so how's the after? Less inflammation?
Oh yeah, some
Mhm.
women absolutely. You'll see that um go on the downward trend for sure.
Mhm.
That's
Yeah.
great. That's
Yeah.
great. Yeah, no, I've had quite a few friends who've done explants and felt an immediate
Yeah.
difference, which
I
is
mean, and I guess
interesting.
it's all with our toxic load, our genetics, some people are fine with them for,
Mhm.
their
Well,
entire
it's
life and it
it's
doesn't
like
matter.
cilantro. Like people
Exactly.
can't some people can't stand
I
cilantro.
can't.
And
Blech.
there's a genetic marker where it makes it taste like soap. So with anything, your body might not be able to handle it. I don't like surgery. My body did not like surgery at all. It was hard to
Right.
recover from it. So I can see that.
Yeah, and I don't like to place a lot of people focus so much on the BRCA genes, and I was studying to be a genetic health coach after I learned all about my own genetics. And it's a deep um hole to go down, but no matter what your genetics are, it's less than what were they saying, even Chrissy, they talked about this a lot at the Annie Appleseed
Oh, yeah,
I
genetics
think it
play a
project.
matters.
very
Very
It's
small.
small
yeah,
part.
it's
Yeah.
a
Yeah. And I
very it's
can't
less than like 5%
yeah, I
of
can't stand it
you know
when physicians harp on that genetic thing. I don't believe it. I didn't believe it
yeah.
20 years ago, my first cancer patient. I was like, there's no way.
Yeah.
It's how we live our lives and our epigenetics that
Yep.
really
Mhm.
is the focus.
Yeah.
So again, going back to what can you do? Decreasing that toxic load,
Mhm.
moving the lymph, detox methods, saunas. Because listen, we're polluted everywhere we turn. Our food,
Mhm.
the chemicals in the air, everything. No matter where we turn, we're getting chemicals. But
Mhm.
to just be able to live as clean of a life, no matter what your genetics are, these are things that everybody should be doing.
Yeah.
And
It's a great thing,
it's
yeah.
like they say that's what pulls the trigger is,
Yeah.
how we live our life. So,
Yeah.
Mhm.
Yep.
We always come
Absolutely.
back around to the same thing,
We
don't
really
we?
do. I feel like
absolutely.
every episode we come
Come
back
back around.
to just like it's all the same theme,
Mhm.
right? And it's
Yep.
just a matter of just starting one
Starting
day at a time.
slowly doing
Slow.
it.
Yep.
Yeah,
Yep.
Mhm.
it's baby
Slowly make those
steps
changes.
because there's so many things. When I started down the path, I've always been pretty healthy. My husband's a chiropractor and functional medicine doctor, so we've always been healthy, but my genetics, I don't detox well. I have MTHFR, homozygous, and all my other methylation genetics are,
Mhm.
um, a little I have
Wonky.
all of them, yeah, so I don't detox that great, so I changed my health around sauna. I bought a sauna. I try to do as much detoxing, methods as I can to keep those pathways clean and open,
Hmm.
and flowing as best as they can, so I
Yeah.
don't end up having issues down the road.
Yep.
Prevention, trying to. Yeah.
That's it. We just got to show up every day for ourselves and
Mhm.
make the small little choices and
Yep.
do what feels aligned for us every single day.
And
Ah,
it
well,
it can
Jody,
be
this was
it can be
amazing.
Thank
very,
you.
daunting because, the
Yeah.
water plays a huge factor. I think the
Mhm.
water is one of the biggest things we can focus on is getting a whole house water filtration system.
And
You know
my husband just changed the filter yesterday after 1 year. It's every year, and he
Yeah,
was
I mean, it's
mortified.
bathing
Mm,
It was
water. You're
disgusting.
bathing and showering and all that chlorine's being
Mhm.
absorbed into us. That not just the drinking water, but that's
Mhm.
a huge one. But the mind
Mhm.
overall, I think the main thing is the mind. Being mentally healthy is probably the biggest thing for healing and, treating
well, yeah,
disease.
that internal dialogue, right? If the mind is constantly on overload and you've got what they call the monkey mind, right? Where it's like bing, 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 it just won't stop. And it's also like just not really present and it's not very kind dialogue, right? Then imagine what it's doing to us internally because we cannot heal a body that we hate. We cannot heal in distress. And when our minds are constantly on, that it's in that sympathetic mode. It's not in the parasympathetic, the rest and, restore type of mode. So the
Yep.
mind is a very huge part in our healing for sure. It's
Yep.
it's definitely up there and it's one that most people don't really think about. They think about, well, I got to change what I eat, I got to change what I do, I got to change what I put on my body and all of that matters for sure. But none of it really will matter if you don't get your mind right as well.
Mm.
Yep. Absolutely.
Mm.
Alright,
Well,
well, thank you.
yes, this
Thanks
was
Thank
for
you.
joining
beautiful.
us today.
Thanks for having me, and I always appreciate working with you.
Yes, and we'll have all of the links to where people can find you below in the show notes, so definitely give Jody a ring and schedule your thermography appointments
Mhm.
and, take your health into your own hands.
Yep, I'm always happy to answer any questions. If people just want to call me and pick my brain, on it, I'm always happy to talk.
Beautiful.
Excellent.
Aw, well, thank you, Jody, so much.
Thanks, ladies.
Alright, until
Alright.
next time, guys. Thank you.
Bye.